Now another buzzword, which is insulin resistance. So what is really an insulin resistance? So just to simplify this a little bit is, if you ate this 1 mug worth of a carbohydrate and my body requires a teeny bit of an insulin to digest this protein. We looked at how the carbohydrates get digested in the body. We looked at the role of the insulin, we looked at the role of the glucagon and their combined effort to keep that sugar level in a very narrow range. The role of the insulin is basically it's going to help all the cells, it's going to tell all the cells to open the door to get that extra sugar into the cell. So it's not floating around in the blood. Now what happens when the cells stop listening to the insulin? So that is the condition which is called as insulin resistance. So if I eat this big of a rice bowl, I used to require this much of an insulin when I was younger. Say 10 years down the line, I'm eating the same amount of rice, but my body needs to make a little extra insulin. That means my cells are getting resistant to the insulin. That means they're not really obeying what the insulin is trying to tell them. So the way the body has figured out is, let me make more insulin. That is your insulin resistance. This is your first pathological step towards pre-diabetes and diabetes. This is a stage, believe it or not, is going to last 5 to 10 years before somebody gets diabetes. So this entire 5 to 10 years, what you are is a pre-diabetic.